Dr. John Coleman is a pulmonary and critical care specialist at Northwestern Memorial Hospital in Chicago. Now he's working in ICUs that have been converted to treat COVID-19 patients. Doctor, it's good to have you with us this evening.
Good evening, Scott. How are you?
I'm well, thank you, and I hope you are as well, and that of your colleagues. Can you take us to the front line tonight? Tell us what it's like in your hospital.
Sure. So we have seen in Illinois and Chicago, we've become an epicenter of coronavirus, and we have, over the last few weeks, seen our numbers grow. And our healthcare system has done an amazing job of kind of having a plan in place of how to strategically plan for these people coming into the ICUs. So we have cohorted all the coronavirus patients into ICUs, and as the numbers increase, we have increasing numbers of ICU beds that we are utilizing. So there's a plan in place for, as the numbers increase, to make sure that we always have the capabilities to care for everybody with coronavirus.
Have the situations in other cities, whether it's New York City or elsewhere, helped you in any way to prepare for what you're facing now and what you might face in the days and weeks ahead?
Absolutely. I think the experience of New York, as well as what we've seen in Italy, has seen that this can surge very quickly, very fast. And so you have to have a multi-layer plan to make sure that your health system can sustain this influx of patients that are coming in. And so we have been, for weeks now, planning PPE, planning ventilators, planning levels of ventilators, planning support staff of how to staff our respiratory therapists, our nurses, our physicians, and how we can pull from everybody in the system to really provide optimal care for people.
I wonder if you could share with our viewers what it must feel like for you personally and your colleagues to know what's coming and have to simply sit and wait for it and be prepared as best you can.
So, yeah, that's a great question, in the sense that I think as physicians and as healthcare providers across the board, we all take that oath to provide for people and when they're sick. And so what is amazing about people in the healthcare system is they stand up when they need to. And so mentally, we're all part of a team. We're all helping each other out. We're working together. It's been a great atmosphere in the sense that, you know, the doctors, the nurses, the respiratory therapists, to limit exposures for people, we're all trying to limit how often people are going into rooms. So like a nurse typically goes in there and administers meds or titrates drips, and a respiratory therapist typically goes in there and adjusts the ventilators. But now if I'm going in there, I'll do that stuff so that they can listen their, exposures to coronavirus. And same thing goes for, like, they're going in there and doing ventilators or drip changes as well. So we're all working together to actually to make sure that we can sustain this influx that's coming.
Appreciate all that you're doing, that of your colleagues as well, and we do wish you well this evening. Thank you, Doctor.
Thank you. You have a nice night.